Well, hello and good evening. I'm your host, Rihanna Harilal, President and founder of the Voice of Lupus Foundation and National Awardee of the Hummingbird Gold Medal. Welcome to the Voice of Lupus Foundation's Let's Talk Lupus webinar series. This educational initiative is approximately 4 years old and seeks to empower lupus patients throughout Trinidad and Tobago by providing them with knowledge, education, and practical solutions to dealing with the brutal impact of living with lupus and to better understand the disease. As you know, I am a lupus warrior, and I am happy to facilitate this session for the benefit of all lupus patients in Trinidad and Tobago, along with family members and caregivers, to better understand what living with a chronic autoimmune disease is like. The Voice of Lupus Foundation is a registered NGO fiercely committed to improving the quality of lives for all people living with lupus in Trinidad and Tobago since 2011. We accomplish this by investing in initiatives, hosting programs and events, and planning campaigns that promote advocacy, awareness, public education, and support for our patients. This evening, we are discussing lupus and your mental health with a focus on depression and anxiety. Facilitating this session is Psychiatric House Officer Dr. Varsha Nanan. Dr. Nanan graduated back in 2015 from the University of the West Indies with a Bachelor of Medicine and a Bachelor of Surgery. She spent 10 months working in anesthesia in San Fernando General Hospital. After that, she began working in psychiatry in 2018. In 2021, she completed part 1 of her Doctors of Medicine in Psychiatry at the University of the West Indies. Currently, she is in her final year of psychiatric specialization. This evening, Dr. Nanan will provide a practical guide on how to protect your mental health, your well-being while battling chronic illness. Now, as you know, with lupus, the immune system attacks instead of protects the body, including the brain and nervous system. Lupus and its treatments can impair mental and emotional health. Now, the following statistics about lupus and mental health were provided by the World Lupus Federation. Neuropsychiatry affects 90% of people with lupus. I'll say that again. Neuropsychiatric lupus affects 90% of people with lupus. Neuropsychiatric lupus describes feelings of depression, headaches, and lupus fog, trouble thinking or remembering due to lupus. 25% of lupus patients experience major depression, and 37% have major anxiety, according to research. Now, pain, fatigue, and other symptoms of lupus can make it hard to work, socialize, and enjoy the simplest of things. Your doctor can help relieve mental health issues caused by lupus, often by changing medications or adding one for anxiety or depression. Life with lupus can be challenging, with symptoms that come and go, disease flares and remissions, and the uncertainty of what each day will bring. It's normal to experience feelings of unhappiness, frustration, anger, or sadness. It's also normal to grieve, and I'll say that again. It is absolutely normal to grieve for the loss of the life you had before lupus. Thank you so much for tuning in, everyone. Dr. Nanan, thank you for being here. There are so many lupus patients who can talk about the beaving and the weaving when it comes to a diagnosis of lupus and dealing with mental health, dealing with anxiety, dealing with this topic. So I thank you for doing this. And before we go further into your presentation, I just want to let everyone know that Dr. Varsha Nanan is spearheading a research right now with the link of doing research with regards to lupus depression and anxiety. We will be circulating that link. It's a list, it's really a survey that will be conducted, and she's going to tell you a little more about it. We need your help. We are partnering with her to get this done. And I understand the Lupus Society of Trinidad and Tobago, they're also taking part to help with their members. And of course, we can only talk about ours, and we can only talk about what we're doing to raise awareness, and of course, to provide a safe space for our patients and to have conversations like this when it comes to mental health, anxiety, and depression. So, Dr. Nanan, the floor is yours. I have made you a co-host, so now you can go ahead with your presentation.
Okay, hi, good night, everyone, and thanks, Ms. Harilal, for having me here, and thanks to everyone for logging in for this talk. So tonight I will be presenting lupus and mental health. So I'm just going to screen share to the presentation. Right. All right, so lupus and mental health. So I will start by talking about the term lupus, right? So I'm just going to minimize this. So I'll break down what the term means. So yes, I'll be focusing on the psychological aspects of lupus, but I'm just going to give some information about lupus in general. Might be things that you already know, so it might just be a revision.
Do me a favor, and can you go on full screen mode?
Yes, it show current slide. Okay, good.
Yes, I think that's a lot better.
Right. Okay, so the word systemic means multiple systems throughout the body being affected. Lupus is actually Latin for wolf, as the lesions resembled wolf bites on the skin surface, and erythematosus means reddening of the skin. So lupus is an autoimmune disease. It affects various organ systems throughout the body. It is a chronic disease characterized by periods of acute relapses or flares and periods of remission. This disease affects the physical, the psychological, as well as the social aspects of a person's well-being. So antibodies, as Ms. Harilal was explaining earlier, are like the body's soldiers that are designed to protect against invaders like viruses and bacteria. But in lupus, these antibodies start to attack the body's own tissues in which they were originally designed to protect. And there are multiple factors that contribute to this: genetic, immunological, endocrine, and environmental. It appears that persons with lupus, they have an inherited predisposition for lupus, and they develop the disease when they come into contact with something in the environment that triggers the lupus. In most cases, however, the causes are unknown. But some of the potential triggers include being exposed to sun, which can cause rashes on the skin, which in turn triggers an internal response, getting certain infections, which could initiate the lupus or cause a relapse in some persons, and certain medications. There's also some linkages to vitamin D, sunlight, cigarette smoking, and hormones, estrogen hormones. So the incidence of SLE peaks in middle adulthood in women, and it occurs later for men. As I was explaining before, that hormones have a role to play. This could explain why it predominantly affects females of childbearing age when estrogen levels are the highest. And females are 8 to 15 times more likely to be afflicted than males for every age and ethnic group, with the average age of being diagnosed at 29 years. The risk decreases after menopause, but females are still more affected than males. And although it is less common in males and children, it tends to be more severe in these populations. So the prevalence of SLE worldwide is estimated to be 6 to 178 persons per 100,000 people. However, the prevalence varies depending on the population being studied. Data regarding the prevalence of SLE in the Caribbean is lacking. The Barbados National Lupus Registry had documented an annual crude incidence rate as 12 per 100,000 persons between 2000 and 2009, and the prevalence rate in females was 153 per 100,000 by the end of 2009. Another study done in Curacao found that the annual incidence rate was 4.6 per 100,000 persons. So right now, the population of Trinidad is estimated to be around 1.26 million, but estimating the prevalence of SLE in Trinidad was difficult because of the scarcity of available data. However, there was a study done by Molake et al. In 2007 that reported in northern Trinidad, there may be around 373 males and females with lupus, and the crude SLE prevalence may be around 219 per 100,000 females. Another study done by Dr. Cornett in 2016 found that there were 169 patients at the time of the study who attended the lupus clinic at San Fernando General Hospital, of which 91 persons had a confirmed diagnosis. So to be diagnosed with lupus, you need to have 4 to 11 criteria. So the first one is the butterfly or the malar rash, which is a rash that occurs in the cheeks, sparing the folds around the nose in the sun-exposed areas. And this is just how it looks in white skin versus pigmented skin. It's not as red. A discoid rash, which is a plaque-like lesion in sun-exposed areas as well. You could also have other rashes throughout the skin in areas exposed to the sun. Ulcers in the mouth and the nasal cavity. Serositis, which is inflammation of the lining of the inner organs, example, the heart and the lungs. Inflammation of the joints, kidney disease. Neurological diseases such as seizures, psychosis, and other psychiatric disorders I'll talk about later. Blood diseases. So when the antibodies attack the red blood cells, a person can become anemic. If it attacks the white blood cells, it could become leukopenic. If it attacks the platelets, it could become thrombocytopenic, as well as the presence of certain antibodies in the blood, example, anti-nuclear antibodies, anti-Smith, anti-double-stranded DNA, and anti-phospholipid antibodies. The most prevalent symptoms, however, are the joint pain, the joint arthritis, as well as the skin lesions. So today I'll be focusing on neuropsychiatric SLE, abbreviated to NPSLE. This is when lupus affects the brain, the spinal cord, and the nerves. And these symptoms, they may come and go or they may persist. Common symptoms include headaches, anxiety, and anxiety could look like being anxious about everyday general activities or social anxiety, phobias, or even having something called obsessive compulsive disorder. Depression, confusion, problems with attention, seizures, stroke, abnormal walking, tremors or shakes, psychosis, problems with your vision, and something called lupus fog, which is a combination of memory loss, fatigue, feeling confused, and trouble expressing your thoughts. The true prevalence of neuropsychiatric SLE is unknown, but is estimated to be anywhere around 12 to 95%, and is also estimated that 5 to 50% of persons with SLE will have psychiatric symptoms at the initial presentation of SLE, and eventually 50% will go on to show psychiatric symptoms. The neuropsychiatric SLE contributes significantly to the disease burden in SLE, and its mortality is second to that of lupus nephritis. A study done by Petrie et al. In 2010 found that depression was the most common psychiatric manifestation in persons with SLE, and another study by G. Marion et al. Found that depression presented in 11 to 39% of persons and may be the initial symptom before SLE is formally diagnosed. Neuropsychiatric disorders such as depression and anxiety can occur due to the direct effects of SLE on the brain itself. So feeling depressed and anxious can actually be symptoms of a flare. But it could occur as a reaction to being diagnosed with a chronic autoimmune disease due to the psychological burden associated with living with this illness and the consequences caused by the disorder, as well as the medications used in the treatment. And psychiatric symptoms in SLE could also be due to another primary psychiatric disorder that is also occurring along with the SLE. But regardless of the source of these disorders, they require detection and treatment. The occurrence of depression in SLE could be anywhere between 17 to 75%, and the occurrence of anxiety and SLE could range between 7 to 39%. And the majority of persons experiencing the first onset of their psychiatric disorders occur prior to being formally diagnosed with SLE. Anxiety and depression has been rising in the population in the past few years, and this is actually an underdiagnosis, either due to persons not knowing the signs or not letting their doctors know. There's no single test to diagnose neuropsychiatric SLE, and it all starts with the doctor asking questions about the symptoms. So depression is a disorder defined by thoughts, behaviors, and feelings, rather than obvious symptoms like rashes and vomiting and fever. So it may be difficult to think of your thoughts, your feelings, and behaviors as symptoms, as they occur in our head and they can seem like decisions. But it's important to know some of the signs and let your doctor know. So a depressed episode is defined as having certain symptoms for the majority of the day, nearly every day for at least 2 weeks. And this may include symptoms related to the way someone feels, so feelings of sadness, tearfulness, feeling guilty, empty, hopeless, worthless, feeling restless, being angry, irritable, and frustrated, even over small matters. Symptoms related to behaviors, such as being socially withdrawn, low energy, low motivation, poor concentration, sleep problems, either difficulty falling asleep, staying asleep, or waking up feeling like you had restless sleep, changes in your appetite, overeating or undereating, and slowness in thinking and body movement. There could be symptoms related to your thoughts, such as having poor self-esteem, loss of interest in activities that you previously enjoyed, and thoughts of dying and suicide. And persons can also experience unexplained physical problems, such as back pain and headaches. So anxiety. Occasional anxiety is a common reaction to when stressful things happen in life, such as writing a big exam or talking in front of a crowd. However, it is only called an anxiety disorder when there's intense, excessive, and persistent worrying and being fearful about everyday situations. And this fear and worry is out of proportion. It interferes with your daily activities. A person finds it difficult to control the level of worrying. This situation might not pose any actual danger or threat, and it could last a long time. And this could lead the person to avoid places and situations to prevent these feelings. Common anxiety signs and symptoms include things like worrying excessively about several things that are about to happen or might happen, feeling nervous, restless, tense, having a sense of impending danger, panic or doom, high heart rate, breathing rapidly, sweating, shaking, feeling weak, tired, low energy, problems with your concentration, you're unable to think about anything else except what you're worrying about, trouble with your sleep again, experiencing muscle tension, headaches, feeling irritable, feeling restless, difficulty controlling the worrying, and having the urge to avoid things that will trigger this anxiety. Many times people sweep depression and anxiety under the rug as a weakness or just nerves or things that a person could just get over. However, there are several things that we could do to cope with problems and hardships which could help. So I'll just discuss briefly some little strategies that persons could practice in order to cope with depression and anxiety. So people who are depressed and who are anxious, they tend to think a lot about what they are doing wrong or what they did wrong in the past, constantly worrying and replaying situations in your head. Imagine if you had a friend that was constantly pointing out everything you did wrong or everything that is wrong in your life. You'd want to avoid this person or get rid of them. And this is what people with depression and anxiety do to themselves all day. They are not kind to themselves. So the first step is to start being kinder to ourselves. Example, forgiving yourself about mistakes that you made in the past or you just made. Another strategy is decreasing something called negative mind filtering. This is when a person just looks for everything negative in the environment and they tend to overlook all the positive or the good experiences. So it involves training your mind to see the upside of things. And to see the upside of things requires work and effort. So studies out of UC Davis found that just writing for a few minutes a day about things that you are grateful about could dramatically boost your happiness and your well-being and your health. Also by sharing good news and not just venting about negative emotions and everything that went wrong with the day. Instead, talk about the good things that happened each day. Another thing to a strategy is that usually when a person starts their day and a few bad things happen to them, it sets the tone, a negative tone for the rest of the day. So strategy is to get yourself out of that mindset so you'll still be able to have a good day and move forward. Other things include ways to think and act in certain ways to help to navigate you through tough times. Ways to increase your resilience. Accepting that painful experiences and hardships are part of the human experience and it's something that connects everyone. So this involves exercises for practicing acceptance, looking for the good in situations, decreasing what is called victimhood, and taking back your power. Focusing on the things that you could change and forgetting the things that you can't. Another easy practice that you could start to incorporate is practicing something called mindfulness. Being mindful involves being focused and aware on what you are sensing and feeling in this very moment. A person who is very anxious is worrying about the future, and a person who is depressed is ruminating about bad experiences in the past. And mindfulness involves exercises like meditation or guided imagery, other techniques to help a person with moment-to-moment awareness of your thoughts, your feelings, the bodily sensations, the things that are going on in the environment, observing them and not judging them as being good or bad. Social support is also protective. This could be in the form of friends, family, or even support groups. So I went through some studies for depression and anxiety in persons with lupus, and the things that stood out were persons who had higher SLE disease activity or more flares, persons with severe pain, fatigue, taking certain medications, not being satisfied with your body image because of the rashes and the weight gain which could occur due to the medications, low social support, low socioeconomic status, being unmarried, lower educational level, impairment in your ability to function in everyday life, being unemployed and work disability, having higher stress levels, higher perceived illness stigma. These are persons who perceive their illness as having negative life consequences and an unpredictable nature, and they had very little understanding of lupus, as well as the unpredictability of the daily symptoms and the uncertainty regarding when another SLE flare could occur, and frequent hospitalizations. So this is why in the survey that I'm conducting, investigating depression and anxiety, the survey was specifically designed based on these risk factors, asking specific questions that was carefully selected based on the existing studies that were done in patients with SLE in other countries. And some of the questions are collecting demographic information like race, religion, marital status, income levels, and it may seem invasive, but what we're actually doing is looking for trends, trying to form associations to try to identify certain groups so we could offer persons a greater level of support that is currently being afforded to them. One aspect of support is through counseling and guidance. Another one could be the possibility of additional medication that the hospital clinics could be providing, as well as prompting referral to additional services. The goal is not just to improve the quality of support that a person could get, but also to improve the quality of your life. The way that you feel about yourself moving forward. For example, when someone is first diagnosed with a chronic autoimmune disease, it's shocking. You go through a range of emotions. You're angry. Lupus is such a rare disease. Like, why did this disease have to choose me? You feel angry, sad, confused, frustrated. Some days you may not feel happy about the things that used to make you feel happy. I want to bring about change in these aspects of their lives, the way that they feel. Yes, you have this disease, but it doesn't just mean that you have to stop getting joy out of life. The goal is to help people find ways again to become happy and feel joyful and feel cheerful and to foster nice, healthy, wholesome, and positive relationships with people that they are close to. We want their lives to be better with psychological support as well as with other aspects of their lives. I am a psychiatric doctor, and psychiatric doctors have a little bit more experience and knowledge than the other specialties that have a general knowledge about psychiatric disorders. But psychiatric doctors have a specific knowledge about how to help people deal with the emotional aspect of being diagnosed and living with this disease. Going forward, when someone says managing a disease doesn't just mean taking medication, to avoid flares, avoiding triggers, your diet, your sleep, your lifestyle. Yes, these are important aspects about managing a disease, but another important factor is trying to maintain the same or close as possible quality of life that you had before. To maintain all the feelings you had before. The entire outlook of life should not just change because a person is diagnosed with a chronic disease. The goal is to help people get back as close as possible to the way they were before. What was normal before then? We want patients to get back to that sense of normalcy, to feel happy, cheerful, feel good about yourself, for their outlook on life to be more positive, to train your mind to have thoughts that in turn will make a person feel happy. So this is why it's important for us to identify the problem, to train doctors as well, the neurologists, the rheumatologists, so they could have like a better understanding and awareness to screen for these diseases, depression and anxiety, and prompt referral to additional services to help people overall cope with this illness. So that's it for the presentation. Now I'd like to open the floor for any questions.
Okay, so before we do that, I would just ask that you stop the screen sharing.
Okay. Yeah.
Good. Perfect. Now, for those of you who heard Dr. Nannan's presentation, and the part that stood out for me was things that, we kind of downplay, like the mere fact that I'm tonight struggling to find words because mental and, brain fog is a real thing. Having been diagnosed with lupus, it's still one of those things that I think that's where, and I'm being very open here, I am very frightened about. When I say frightened, because one of my biggest fear is losing my entire memory, and also the ability to converse with people, to make sense. Because when sometimes you are inundated and you feel so stressed and you are going through the highs and lows of lupus, knowing that there's a possibility it affects your brain, and it could affect your brain, and it could affect your just everything, that's not an easy thing to digest. For me, being a broadcast journalist whose career basically ended because of a diagnosis of lupus, it has been really challenging to accept, because for many of you, I know you all have been forced to quit school, quit your job, you were fired, you lost your career, you lost your livelihood, having to go on disability, some of you public assistance, and it's not easy. So I would like to, open this floor, because I'm sure I'm not the only one who this just felt like it connected. And you are not crazy. You are not losing your mind. This is all part of, unfortunately, the progression of the illness. So I'd like you to unmute your mics for those of you who are comfortable enough, like Ruby, to keep the camera on. Hi, Ruby. I'm not hearing you. You're muted. Let me see if I can unmute you. Okay, no, I can't. Yeah, here we go. Hi, Ruby. I'm just giving you a shout because I feel like it's ages I haven't seen you, and it's nice that you tuned in.
My hands are very full, very full.
Yes, you tuned in. Right. So what I'm going to do, just out of respect for the fact that this is now a closed space, I am going to stop the live so that persons who are going to share personally, it is not going to be broadcast for anyone except us to hear. So for all of you tuning in on our YouTube channel, thank you so much for viewing. We are going into a closed discussion right now, talking about lupus, mental health, with a focus on, of course, focus on anxiety and, of course, depression. So this evening's session was hosted by Dr. Vasha Nanan. She is a psychiatric house officer attached to the SWRHA. So we say thank you for tuning in. Everyone, have a good night. We will be, of course, on Zoom if you would like to